Good afternoon. Thank you all so much for coming. It's great to have such a good crowd. We've been looking forward to this event for a long time, I guess since November of last year. My name is Gib Clark. I'm a senior program associate here with the Woodrow Wilson Center's Environmental Change and Security Program. Before I get started, I'd like to remind everyone to turn off their cell phone. That's not something I usually do, but I just wanted to make a point of it because mine is going to be on. Because my wife is due, we think, today, and so by way of apologies for any nervous behavior I exhibit today. For those of you who haven't been to the Wilson Center before, just a quick word about it. The Wilson Center was formed in 1968 by an act of Congress. The idea was to set up a living memorial for Wilson, our 28th president. He was the only president to have earned a PhD, for better or for worse. And also, as he was the only president, he was also the president of Princeton University. So the thought was to bring together the world of ideas with the world of policy. And we try to do that here. The ECSP, the Environmental Change and Security Program, is going on its 14th year now. And we, through publications and events like this, we explore the connections between population, health, environment, and security, among other things. These issues, of course, are complex and interconnected, and we'll be looking at some of those connections today. Excuse me. As I said, we've been looking forward to this event since November of last year, when there was a conference run by PRB, the Population Reference Bureau, in Addis Ababa, bringing together PhD programs from around East Africa. And we handpicked three of the most interesting people representing the most interesting programs, and we somehow talked them into coming today to discuss their experiences. This was an unusual conference in that it generated not just a lot of empty promises, but actual momentum. And we've seen since the conference ended a regional network form and national networks in Uganda, Tanzania, Rwanda, Ethiopia, and Kenya. And these different networks are bringing people together who do population health environment programs. Some call themselves those, and some call themselves PHE, some have other ways of saying it. But the underlying principle is that everyone's doing integrated population health and environment programming. It was also really encouraging to see these programs who didn't necessarily know each other or know about each other, to see that they were not alone and that there was, in fact, a very large community of other programs and other organizations doing PHE. So we're really excited about the work that's come out of the conference and the follow-up work with the regional and national networks, and are hopeful to see longer term what happens. There's been a lot. We've written a lot about it here at the Wilson Center, and also PRB and some others, and some of the publications are available outside. Today's event is the fifth in a series of events, of an 18-month series that we're holding here called PHE, Building the Foundation for the Next 10 Years. The past events have included exploring climate change and population linkages, and recent evaluations of PHE programs. In the future, we're going to be having a few more sessions looking at case studies of PHE programs in different countries, and at such things as the PHE research agenda and funding. Two other related events coming up soon. On May 16th, we will be hosting Leona Diagnos, who is the the technical director of PATH Foundation Philippines, and she is representing a program called IPOPCORM, and that is a very long name, which stands for Integrated Population and Coastal Resource Management. They've come to the end of their program, and they have some really interesting results to talk about. And then on the 21st, 2 weeks from yesterday, Gladys will be returning to the Wilson Center, and for an event featuring also Steve Osofsky, who's back there in the corner. And that event will be looking at human, animal, and environmental health linkages. In the interim, Gladys will be going to San Diego, where she's going to accept the 2008 Conservation in Action Award from the San Diego Zoo. I'm not going to get too much into the bios as you've got, I think, almost a 2-page handout with them, but just briefly by way of introduction. First, we're going to hear from Gladys Kalema-Zikusoka. She is a veterinarian. She is the founder and CEO of Conservation Through Public Health, a Ugandan NGO with an office at Colgate University. In 2006, Gladys became an Ashoka Fellow, recognizing her social entrepreneurialism. We'll next hear from Kuntai Karmushu, who is the head coordinator of an HIV/AIDS program at the Ilnwesi Side Group Ranch in Kenya. He's the community representative on the Ilnwesi Company Board of Directors and represents them in a variety of other forums and committees. And finally, we'll hear from Emmanuel Mtiti, who is the manager of the Jane Goodall Institute's Lake Tanganyika Catchment Reforestation and Education Project, or TAKARI, in Tanzania. He holds a certificate in health management from Georgia State University's Global Health Action Program. So I've said enough. I'll just say one last thing, which is, as you'll see, there's a camera in the back. We are webcasting this event live, and it will also be up in about a week's time alongside a video of this event, a meeting summary, and also the presentations that these three will give. So when we come to the question and answer, please wait for a microphone to come around and let people in the web audience know who you are. So thanks again, everyone, for coming, and look forward to 3 interesting presentations and discussion. And Gladys, we'll start with you.
Okay. View show. Okay. Good afternoon, everyone. I'm very happy to be here at the Rudo Ruson Center, giving a presentation on the population health and environment programs that we're doing around Bwindi in Uganda. I would like to start off by acknowledging USAID, who have funded our PHE initiative in Uganda. They trusted us enough to start off with us in Uganda. And also John Snow International, who have supported Dr. Lynn Gaffikin, who unfortunately can't be here because her mother's ill, but she's been advising us all through. And Kanungu District, and Bwindi Community Health Center, who've been instrumental in getting everything going, and Family Health International, who have started to support us through our CB depot. My presentation outline will talk a little bit about the background of how CTPH began. We started off focusing on health and environment, and later on we introduced family planning to have the PHE program. And I'll focus more on the results of our activities 1 year after implementation, a few lessons learned, and the way forward. I'll be very fast through the slides. Sorry, I think I have too many slides. But we started CTPH because we realized that people living around protected areas in Africa are among the poorest. They have very little health care and information on diseases that can spread between people and animals. This has led to a lot of diseases spreading at the human-wildlife-livestock interface, especially between closely related animals. And because of this, these people have very little health care because they're the last people who the government thinks about. They start off with the big cities and then the rural areas, and then eventually they get to the national parks, if at all. In this area, for example, this is Bwindi Impenetrable National Park. And actually from here you can see the Virungas volcanoes. And this is typical of how people live. In fact, this is a wealthy family because they have iron sheet roofs, but normally they just have grass thatch roofs. And over here you find that the gorillas are here and the people are here, and they live very closely with each other. They also find it very difficult to get to the doctor because they live in such a terrain, and they tend to have preventable infectious diseases which can spread to and from animals. Our PHE program began in Bwindi. Bwindi Impenetrable National Park is home to half of the world's mountain gorillas, which now number about 760. And in Burundi, when I worked as a vet for Uganda Wildlife Authority, we had the first scabies skin disease outbreak in gorillas, which was traced to people living around the park who have very little health care. This was a very big shock for us because we wondered, how did the gorillas get scabies? This infant who you see over here died, and the rest of the group only got better after treatment with ivermectin. And we suddenly realized that scabies is a very common disease in people living around Burundi because they have poor hygiene. They bathe typically once a week when they go to church on Sunday. If they miss church this Sunday, then they bathe after 2 weeks. And they have to walk very far to collect water. That's part of the reason. But also, they don't realize that it's important. And for example, this is Burundi Forest. There's a gorilla group in here. We tracked it in Kuringo. We walked out. This is someone's house. And this is a banana plantation. They love to eat the banana plant, not the fruit, which is worse because they destroy the whole plant and people get very upset. But this happens a lot. And so in 2000, when I was still in UA, Wildlife Authority, I was asked to start a health education campaign for the communities around the park and on human and gorilla disease transmission. And of course, when we started this campaign, some people were worried that the community would think we care more about animals than people, but actually they were very willing to listen to what we had to say, especially the ones that benefited from tourism in Buhoma. But when we went to the other parts in Kuringo and in Congo, we even went into DRC, because this group that got scabies was always going into DRC. They lied to us that they had never seen gorillas, because they had never got any benefits from tourism, and they thought we had come to arrest them. And these are the kind of brochures we gave out, obviously in the local language mainly, but they talked about all these diseases. The ones on the left have been suspected to have spread between people and animals, or animals and people. And the ones on the right were common in the community, but could also spread between people and gorillas. And they were very simple. If you want to go to the toilet, dig a hole 30 centimeters deep. Many of these people, not only didn't they wash their clothes often or bathe, kids would shit in the garden, they wouldn't cover their rubbish heaps. So there were many things that they used to do which were totally unhygienic and were a great risk when the gorillas came into their gardens. They were supposed to have pit latrines, but many of them didn't. So we worked closely with the district health assistants and the community conservation rangers, and this was funded by IGCP. And they came up with these recommendations. They want health and diagnostic services closer, which was a responsibility of Ministry of Health. And they wanted Wildlife Authority to strengthen the human-gorilla conflict team, made up of community members trained by UA to chase gorillas back to the park. Some of them wanted compensation for crop damage, but the Uganda law doesn't allow it yet. And personal hygiene, we thought, was their responsibility. And gorilla tourism has done a lot for the communities in Burundi. Before gorilla tourism, there was nothing else other than a tea factory close by. And these are kids from Burundi Orphan School, which was started because of tourism. Tourists sponsor kids to go to school. And they were dancing the gorilla dance over here. And this situation still occurs. This photograph I just took a few months ago. And this is another gorilla group that likes to range very close to the park. And they were just Rushegura group, that's a silverback, because it's quite far off. But this was a gravity water scheme, which IGCP helped to build. And these gorillas were ranging in this area. They were also ranging close to where the army is camped inside the park, and they're very unhygienic. So there's so many areas where the gorillas can pick up diseases from people. We also did some TB surveys in Burundi and Queen Elizabeth National Park between completing at Wildlife Authority and starting the NGO when I was at NC State. Through our AWF fellowship, we were able to find 25% of chronic coughers had TB around the park, and 5% of the park staff who were not showing clinical signs. 2 people died during the research because of not completing treatment. These are some of the areas where the positive cases were in all the major cities, major villages close by. And so there was a great risk from the gorillas getting TB. So this led us to start CTPH. And we registered also in the US, because we started here, and in Uganda. And we have the patron, as Queen of Buganda as our patron. And we're growing every day. We currently have 18 staff. And we've had volunteers from various places. And we integrate wildlife conservation and public health, which is interdependent in and around protected areas in Africa. We feel that this is more cost-effective way to prevent and control disease transmission between people, wildlife, and livestock. And disease not only affects conservation and public health, but also ecotourism livelihoods, agriculture, and culture. Our mission is to promote conservation and public health by improving primary health care to people and animals in and around protected areas in Africa. And our vision is to prevent and control disease transmission where people, wildlife, and their animals meet, while cultivating a winning attitude to conservation and public health in local communities. We have 3 integrated programs: human public health, wildlife health monitoring, and information education and communication. Today I'm going to mainly talk about the human public health program, which consists of education campaigns, similar to what we did when I was still in UA, but we built on those quite a lot. And we focus on good hygiene, zoonosis, and links to gorilla health, ecotourism, and livelihoods. We're also strengthening community-based healthcare, which actually, when I did the TB research, I realized was really the way forward for rural communities in places like Africa, because people live so far away from health centers. So the only sustainable way of making sure that they get proper treatment for the most basic diseases is by establishing community-based healthcare. And it's now a Ministry of Health strategy in Uganda. And we're also building on these existing structures to promote community-focused family planning in villages around Bwindi. And in our campaigns, we started off with drama workshops, where we basically strengthen existing drama groups. We don't try and set up any new ones. And we give them the brochures which I showed you when we were in 2000. And we told them what we're trying to portray. And they come out with a very, very good message. And in the local language, they each have very good stories. And everybody's highly entertained and amused and educated at the same time. We also get children coming to these drama shows, and which is really good because they're the leaders of tomorrow. And we've reached over 7,000 people working with 2 drama groups. We've also erected health message signposts around the park, talking about these risks of human and gorilla disease transmission. And we had to form an MOU with the district local government and Ministry of Health in order to start the public health programs. We met with local leaders and traditional healers, and what our staff do is that they identify TB suspect patients and get their samples to the government health center and the Bwindi Community Health Center. The NGO Missionary Hospital doesn't actually like to get samples. They want to actually see the patients. But some of the patients don't want to go all the way there. So if they don't want to go all the way there, then our staff collect their sputum samples and carry them to the government health center. The government doesn't really want to see patients, so it's quite a good arrangement. They just want to get the sputum samples. They close their TB ward, so we tend to work with both of them, and we're learning a lot about how to work with different partners with different philosophies, but it's going really well. With the traditional healers, and this was a group of people who, when we started CTPH, we never thought about working with, but when we held a workshop to launch the programs, before we began, everyone felt that we should start to work with them. And when we work with them, it's been very rewarding. And we're getting them to admit that they can't treat TB and HIV. But the thing is, the reason why it's so important to include them is that most people, 90% of people around Bwindi and in rural areas in Uganda, first go to the traditional healer when they're sick, before they go to the modern healer. And if they're not getting better, then they eventually get to the hospital. So if you don't include the traditional healers, you miss a lot of patients, and it will be very hard to control diseases like TB. And so when we've had workshops with them, they've actually admitted that they can't treat TB and HIV. They said they're dying of TB and HIV, and they're willing to refer patients, and we also want them to become their community volunteers. And in the CB Dots program, what makes it really effective is that if you're diagnosed with TB, you choose your volunteer, someone who will actually taking medicine every day for 8 months. And after that, and that person should be able to read and write because they have to tick off a form on the National TB Leprosy Register. So we tell the traditional healers that if they become the volunteers, they won't lose their patient. They'll still continue to have their patient. And when the patient gets better, they'll give all the credit to the traditional healer. And it seems to be working. It's worked in other parts of Uganda where this whole program began. It actually started in Chiboga district as a pilot by the head of the TB program in Uganda. It's a place where my mom also used to be a member of parliament. And it worked really well that WHO adopted it as a strategy for the whole of the 22 worst-affected countries with TB around the world. And one thing that the traditional healers keep on saying, and when we have meetings with them, we always invite people from Wildlife Authority and people from the Ministry of Health, they always say that, well, we have a medicinal plant which treats TB, but it's in the forest and you can't allow us to go there. And so, of course, we try and tell them it's probably not in the forest, but they do want to go in and collect plants for other reasons. And so Wildlife Authority responds, has a chance to interact with them and say there are certain zones in the forest where they're allowed to go and other zones when they're not allowed to go. So it tends to be working really well. And actually, one of the healers said he had a treatment for TB, which was marijuana and honey. And everybody laughed at him, his fellow traditional healers. And we kind of said, yeah, it can probably treat cough, but, but not TB. And we've teamed up with Theta, which is Traditional and Modern Practitioners Together Against HIV. Theta was created after TASO, which was the AIDS support organization, founded by a Ugandan lady when the AIDS epidemic was really high. And they realized that traditional healers, a lot of people went to traditional healers for symptomatic infections of HIV, and it was working. So we work closely with them as well. And so far in the CB-DOTS program, we've had 52 people enrolled, 33 completed treatments, 9 on treatment, 5 defaulted, and 5 died. This is better than what you normally get, usually. And this is our nurse aide carrying out questionnaires. When he goes to the community, he also asks them not only if they've been coughing for more than 3 weeks, but how often they see gorillas. So we try and link everything. The whole program is linked to the environment. And one of the challenges, some of the challenges we've had, is convincing health partners that community-based healthcare can complement their efforts. Not so much the government, but the NGO missionary hospital. But once they were convinced, they're working really well with us now. And then we've had limited resources to continue the programs in one of the parishes that doesn't border the park. Because when we started with Irish funding, they didn't mind where we were. And we worked on Mukono and Bujeng and Cheshero, and the reason we went to Cheshero is because our first field officer was from there. And then when USAID funding came in, which was due to funding from threats to biodiversity, they wanted us to focus on parishes where gorillas come outside. And so then we had to choose another parish. And at the health centers, even if we take samples to the government health center, a lot of the times the technician is not very motivated. The first one was, but the second one isn't, who replaced him. So we have a challenge. And we've had to get some of our staff to go out there and actually do the analysis, some of our vet technicians. And also people tend to be alcoholics, and it prevents the daily treatment. And now coming back to some of our other programs that link in, we have wildlife health monitoring, where you have data from gorilla and livestock health analysis. Park staff bring in samples every week, and we analyze them. And then we have a telecenter where community members come in and learn how to use the email and internet. And with it, we've even worked with some of them in the community health programs. We've had over 150 people graduating in computer studies. And we've had, the community and the tourists using the internet a lot, especially the community. And they're willing to pay for it. So the PHE program came in to strengthen all these. And we feel that PHE is very important, especially in Burundi, because the average family size is 10 children per family, and this is the live births. And a lot of them say that half my children are to go to school and the other half are to chase gorillas in the garden. So this is a kind of situation we have in Burundi. It's a very hard edge. And so with a very high population density, people just go into the forest for firewood, for basic needs, to poach and collect firewood. And the bigger the families, the worse the pressure on the forest. So a needs assessment for family planning was done by Mbara University School of Science and Technology. They have a medical school, and also an independent survey. And it found that there were many myths and misconceptions about family planning, and men and women did not discuss family planning. So we decided to focus on couples. I remember Heather said to us, you should only focus on couples, teenagers, men or women, don't mix everything. So we thought we'd focus on couples. And there was a care model had been around where they had community reproductive health workers, but we built that one further on the advice of the district medical officer, and also got couple peer educators, one from each village. And we also hired a nurse midwife who's a PHE program coordinator, and she provides expertise to our nurse aide who was already there. And the objectives were to reduce family size and human-wildlife interactions, and to increase capacity to implement family planning, health, and environment interventions, increase access to information and education on family planning, increase acceptance of family planning among target community members, and reduce the risk of human disease to mountain gorillas. In the end, we've ended up training 4 community reproductive health workers and 24 Kapopia educators, and they're doing very well. They inform people about the benefits and methods of family planning, primarily through village health talks and targeted home visits, and they refer potential clients to health centers. We have monthly meetings with the crews and quarterly meetings with the CPEs. Lynn Gaffikin had come to visit over there. And at these meetings, they go through all the data sheets. It's taken a while to get the data sheets right, because every time you add something, it requires a lot of training, because these people are not highly educated. And we go through the data sheets, and they tell us the challenges they're facing. In the first year of PHE implementation, we've had a very great response. We expected to have 30 new users, because there was hardly any family planning, but we've had 147. And we expected to have, which is 490%. And what is most interesting is that the PHE volunteers have been taught to recognize people who are coughing a lot when they visit people's homes and when they go to the villages. And they have been able to refer 480 patients in 1 year, which is much, much higher than what the nurse aide was trying to do when he went to the villages, or even what the community leaders or traditional healers were doing. So it's integrating family planning and TB has really helped the TB work. We've also had new targeted health visits to homes bordering the park with people who see gorillas. And this is very significant because when they carried out a study to see how successful integrated conservation and development initiatives were, they found that the poorest people still didn't benefit, and they were still poaching and still collecting firewood. And so people were trying to say that ICDs are not useful, they're not important. But we think that the reason why they didn't work is they were targeting the wrong people. Because obviously when you hold a village meeting, it's easier to get the people who are educated or the people who are aware and who are not so close to the forest edge, because they have the time to go there and they have the resources. And of course you get numbers, but you don't get the right people. So by visiting people's homes, they're able to get to the right people. And we've also had women opting for new methods such as implants, which are being used at the Bwindi Community Health Center. So in 2007, we had over 1,000 homes visited, and over these 540 were homes that saw gorillas, and which are the hardest to reach. And we managed to reach almost 3,000 people in health talks, reported 480 TB suspects, and very many condoms distributed, 23,000. And so we've had a very good results in the first year. And then when Dr. Lynn Gaffikin came in December, we tried to see now it's better to study the new homes which are visited, not just the total homes. So we now looking at the new homes that are visited, we're beginning to get data on that. Number of new homes visited, number of new homes that saw gorillas, and number of new homes followed up. We also have managed to get, right now we have 588 family planning clients that we know of. But of these, 147 are new. They've come on because of the project. And Depo-Provera seems to be the most popular method, but the records are mainly at the health center. So in order to integrate scabies HIV into this whole program, we met with local leaders. And we told them from the beginning that at least 25% of the homes should be homes that border the park. And the scabies focus is on good hygiene, and HIV focus is to educate them to go to the health centers. We've also had more drama shows on these concepts, adding in family planning, HIV and scabies. And we've also started our radio programs. In the first 1 month of the pilot radio program, we had a very good response. And people came on with testimonies. There's a lady who had 9 children, and she was on the implant. We asked her to come on with her husband. And she came on, and everybody was very excited to hear what she had to say. They come on together with the district health people and the Wildlife Authority. And then we also have flip charts, which I don't know if I have time to show you, but I'll very, very, very quickly go through it. They go around showing these. This is a negative family with a mother who's had 8 children and she's expecting a 3rd. Only half of her kids go to school. And the father goes to poach because they need food. This is illegal. She talks to him about family planning and he's not interested. And then the gorillas come into the garden, the children chase them away, the mother continues digging, the father goes to the bar to drink, comes back and threatens to chase her away, and the children are crying, and then the eldest son has two wives who he can't support, they stay at home, they're pregnant, he's leaving them, and 2 children have died. That's a negative story. And then the positive one is a young couple who plan when they're still young. How many children will we have? They have 4 children 10 years later, nicely spaced out, all going to school. Then they're all sitting at home having lunch and doing household chores. Then when the gorillas come, they call out the Hugo instead of trying to chase them away themselves. So they're aware of what they should do and the benefits of the park. Then the son graduates, becomes a park ranger. So then they have a discussion around that and why is family planning important. And then the last thing that we've done is we've set up community websites. One is bwindicommunity.ctph.org. And the crews and CPEs have started to get free classes. And they're beginning to be able to analyze their PHE data on the computer. So the challenges we've had, clients arriving at health centers and not being attended to because family planning is not considered a priority at the health centers. So our PHE coordinator comes in and helps 1 day a week in each of the health centers. It's hard to track referrals by the CPEs. It takes a lot of time to train the community volunteers, but there's a lot of research information we could collect. So we're trying to get around that problem. And sometimes they want to ask for a salary, but we've actually helping them out with income-generating projects. We've learned that targeted home visits help. It's good to focus on couples, and integration helped. And we're starting a community-based depot, Provera, where people will be able to go into people's houses and give them an injection every 3 months. And FHI has brought in some money for this. And in this month, we're going to have a 2-week training of all the community, 12 of the community volunteers. They also want to form a CBO, a PHE community-based organization, which is great to sustain the efforts, and we're hoping to facilitate that. And they also, one group wants to have a goat project, another one a cow project, to generate income and sustain their activities. So PHE is supporting that. And then we want them to learn how to use GPS, and we want to build in a community radio component. And the Uganda PHE working group, just very quickly, these are some of the people in it. We're working with PRRB to do the Uganda PHE assessment. Melissa came over 2 months ago. We're creating awareness of PHE in the Uganda media. They're giving us some free airtime, but we're just about to begin that. And we have Victoria Sebagereka, who used to be a member of parliament, so she's helping to advocate for PHE among politicians. We're trying to see how we can set up transboundary PHE programs and look at PHE because we have a big problem with pastoralists in the country, both in national parks and in other areas. And recently there was an eco-agriculture training workshop where we were invited and our program coordinator went. And I think some of these have already been mentioned, the Shoka Fellowship and the San Diego Zoo and Seed Magazine. So our strategy is to train government health workers and other grassroots practitioners through capacity building, work with multidisciplinary teams, and empower target communities. I want to acknowledge all these people who've helped us in various ways to get going, and our staff. For more information, please visit our website. Thank you.
Okay, Gladys, thank you so much. That was great. We went through some of those slides rather quickly, so we'll, as I mentioned earlier, we're going to have all this online shortly. And maybe afterwards we can have the flip chart available too, and take a look through it. And next we're going to go to Kuntai Karmushu, who's going to talk about the Ilnwesi group ranch in Kenya.
Thanks a lot, Gilbert. And as Gilbert mentioned my name, I'm Kuntai, and coming from Ilnwesi community. It's a community base. We are not really based on research. And it's our vision who get us to PHE, not really that we manage or we contacted by anybody, but very much going through my presentation, you will see how our vision drives us to PHE. And actually we started with PHE last year when actually they were preparing to Ethiopia conference, and I'll go through my presentation and you'll find it. And that's very much the community, and that land will be focused. It's a piece of land focusing on 3 major areas: the community, the pastoralism. I think my colleague mentioned a lot of the things why we are there. Is very much up country, and the community is being mostly sidelined by most of the issue people need. And we have several things going on, and we'll see them. We have tourism, community, livestock keeping, and wildlife. And the whole case study will go through Ilungwesi Group Ranch. And the overview of Ilungwesi you can read, but it's a community-owned land. It's a group ranch. A group ranch came under Act of Kenya 1978, when the government put up some remote land and tried to divide into big lands and the people own. And it has currently now 634 registered members, representing a population of 7,010 members. We look them in household, and that's why we put them as 7,000 household represent. And collectively, we really use our land to improve the livelihood of our society. And I know most have been talking to people, and most of the people have been in Kenya, and that's the map of Kenya, and that's our location. We are in Laikipia district of Rift Valley. Covered, our land is 16,500 hectares. In that, we have conserved 80% of our land for conservation. And for those people who have been in Kenya, because I know a number of people have been to Laikipia, we now fall under Laikipia North District after the current administration and all this. As I said earlier, our vision and mission drive us to PHE, because our vision say integrate community development and sustainable environment management. And our mission to improve livelihood by generating of income through eco-friendly activities in order to conserve wildlife and its habitat, uphold the Maasai culture, and develop local community. That's why I said our vision drivers, because one thing we really consider environment as one of our major components, and our main thing is to focus of income. As I said, that we live in up country. There is no roads, there is no health centers, there is nothing there. But now the community come together, work themselves, and try to improve their livelihood through their land. Our land is very dry. And that's why all of a sudden we were found by PHE. Even we are just starting talking and telling the community there is this animal or whatever called PHE, and how can we have it. But already we are practicing it without it coming in place, so and without that branding or thing PHE and all that. These are the project, the small projects or the project which are real under Ilungwesi, which is preserve the Maasai culture. If you see my picture, you can see people, all those beadwork which are done by women in our community. We have one picture there showing Olosho. If you look some of my cats, you love that. It's a new program that we have started on controlling HIV. We have wildlife, and one of my picture also have, we are starting marking some or observing one of the day. One of my picture up there showing the HIV AIDS Day, which is 1st December, and we are able to do it and take that message to the community, and they go around, having these people going around and telling people what is this. And we have public health and HIV within the community. We have education, improve access, clean and safe water, environment conservation and security, tourism, and income generating activities, and we have infrastructure development. I'll try to go one by one, and actually, as I said, our vision of drivers to PHE, we have public health and HIV program. I know we have started capacity build. We are targeting first a population of 20,000 people. These are the population we are targeting, at least to have information on HIV, AIDS, have information on malaria, tuberculosis, and this is our population. And also, currently now we are working on having these people know this information and testing 5,000 people within that population on HIV AIDS. And I live in ground, people doing mobile VCT, and working on how to do to eradicate stigma, support, and awareness creation and all these things. We do it mobile, house to house, and we have a group, we call them peer educators. We train them to have basics information on all this, what we do, and we send them in the ground, and we have our coordinators who work with them. And that's very much a self-explanatory, and that's what we do in the ground. But the most important thing I really appreciate is the 2006 Ilungwesi Leaders Declaration on HIV/AIDS. This is the time when we started basing ourselves on health issue, and the HIV program is now 1 year old. Although malaria, tuberculosis, and FP and the NPA, mean family planning and reproductive health, is 6 months old, so we are just starting and thinking how can we do it, but just following our vision to improve our livelihood, how can we get these people know this and have basic skill. And also one of our targets doing this is bringing government closer to the people, because our project work with now government, we try to link with the bodies which are doing that, and we bring them to ground and they understand this is happening and how can we do this. And when we collaborate, we are now working, what's our vision is to have this government in place at 2 years time, and we start institutionalize them, like especially health. That's what we are trying to do now. We go to environment and resource conflicts. The first picture there, when we mark our environment day and we start teaching people, because most of these people, they use firewood on cooking and do also, we try to make, we have a demonstration center to look on stuff which consume fuel less than how it usually do, and that's how we try to educate people on this. And we have a number of projects, and our main thing when I say to have all these things existing in that land, to have people doing well and to have livestock there, to have wildlife and all of us existing. So among the things now we have done on environment, we have introduced black rhino. Actually in Kenya it's a state rhino, and it was diminished in that land 30 years ago, but currently now we are managing to have one, and we have introduced the white rhino, which actually is an introduction from South Africa, and now we have 2 in Ilungwesi. And for us to do grazing management, as you see a livestock picture there, we are able to develop grazing by laws. This we try to put our lands in patterns and look how can we manage the grass that people can move to one area at one time, being a pastoralism community. And also for them to appreciate for us to appreciate conservation, we really need to consider livestock as the priority. And how can we consider to have grass for them and to have that capacity building. And the land which is set by conservation, we use them in dry seasons to feed our livestock and have them feed in pattern that our livestock really don't die very easily or all of a sudden when a drought comes and all this. And we have the Ilungwesi Lodge, and we set up a wildlife monitoring system that we have a scouting team, possibly you'll see it in my further presentation, and these people do a lot on monitoring and security. And also we try to control our population, but our main vision there before is to buy land outside our group ranch through the income from the tourism, and try have our people go and resettle there. We are there slowly, but it's still something coming up, especially said that we are just now starting the FP family planning and the reproductive health part, so it's something just we are beginning, and we are really not sure of that population. Also, Maasai believing that children as a part of health, so as many as you have, you will be more healthy and respected. And that's conservation and security. When you look my first pictures, we try to do conservation, and I told you we have a black rhino, and all of around late 70s, all rhinos are pushed. The first picture there, we are trying to do to put our monitoring, a recipient monitoring, so we can monitor this rhino within a conservation, and they are putting, and even you can look one of our security having the recipient thing try to monitor where the rhino is. Currently now we are really monitoring rhinos and the cats, which are predators. You know, the most things which they are is predators, because they feed on livestock, and as soon as they feed on livestock, some of the people kill, some of the people poison, and that's why we have to put this such a kind of program, and we have security in place to do. And the security also maintain the community bylaws. We have some bylaws I mentioned. First, we have bylaws on grazing. We have also bylaws, the group ranch bylaws, which also manage us and control everything. And wherever anything happens, we have our security, and they can handle anything concerning or breaking of the bylaws. And that's very much the work of our security. And they also, as I said earlier, they monitor wildlife a lot. They have sick wildlife in case, because we work closely with Kenya Wildlife Service. In case of anything, they can contact Wildlife Service and Kenya Wildlife Service, and they can work with them, and they take the necessary action. They also link, really, when you look northern Kenya, even in our maps and all this is kind of an security region, and there is poaching, you know. So we link with other communities together, and also they assist the government, because we work with the government. These are the security, some of them are armed, and these are through government, and we have those licenses, so they have also to assist the government. Ecotourism part, and this is really, I need to say something on ecotourism. That's really the Ilmwesi backbone. All our projects are being sustained by ecotourism. So we have a Ilmwesi Lodge, and it was established in 1996. We were funded by USAID through a program called COBRA. And I think it was under David Weston, and they realized in Kenya, they put a bylaw saying that they realized they will never manage to conserve wildlife without having those people who live with wildlife involved on doing this. So by then they come up with this program, and the only way they could approach communities is through having them build something like a tourism activity and all that. And Ilmwesi really picked the first year. It's the first community in Kenya who did this, although now we have a lot of communities who really learn from Ilmwesi and start doing it. It's a 6 cottage with 12 bed. The other thing, as I said earlier, our vision really consider on environment is that we really need to target the number of beds, because we are not really targeting on mass tourism. We really want to do a responsible tourism where we consider environment. When we have mass tourism, everything will get distracted. And when you go to that conservation, there is one single entry. We really encourage bushwalks, and rather than driving all over. When we did a case study, kind of a tour, how we work is, we take our people, our elders or our forum committees to go and see, like Masai Mara, how they have drive all over the place, and they have destroyed even small things in the environment that we need. And that's why we try to focus to make sure that we need everything in that habitat to exist, and that's why we try to make sure that we are doing a responsible. And the other also thing we try to do, we create an employee to our people. The lodge actually have 20 staff, and 99% coming from the local community. Because when you get there, you will see all of them dress mostly like me. This is our culture, and that's how all of the staff dressed on the lodge, and they enjoy that. And the lodge is really run by the community. The board of members are the community members, and we borrow some skills somewhere. Possibly we need to co-opt somebody to assist us in some part, marketing and all this. However, our marketing depends with the mouth to mouth, like this one. This is a big marketing and it's really a big honor. And I will say this is a very big honor for the Woodrow Center to have Ilmwesi, because we are not based on research, so less people know Ilmwesi, but we are there just doing a fabulous and a vibrant job, but really less people, and we depend with tourism. And as I mentioned, this is our main source of income. It's really one of the big sources of income. I know we have friends, but this is our main. Like now we are just in crisis because of what happened in our country. We really have less bookings. We were looking on our booking on June and all this. There is no clients, and I don't know what we do. And that's our big revenue. And I just put small. I know we are not based really on research. This is among the places we are now coming in, but we try to look how is our business going. And these are more like our sources of income. We have Ilmwesi Lodge, the one I said sensibly in 1996. We have a cultural bomber. with this where we look at, we are not really taking to our culture to museum when we mean in our cultural bomber, but it's very hard to go and find cattle herders and tell them, show him how, but it's very good to have one location that people can, like our clients, guests, to go and see what we are doing. And we have campsite, we have also a camel walk safari, and we have conservation fee. Actually, this helps us a lot on maintaining our security, who are doing all that, and we have friends and development partners. We really have goodwillers who really realize we are doing, like now, I really didn't acknowledge, but we are working with the FHI through USAID again, and some people who come in and they try to work with us in doing some part, which I said, they look our vision, we are really, but we are lacking this component, and we get together and appreciate, but always we are on the move, try to achieve our vision. And that's how we distribute yearly revenue. Currently now we have placed education 1.2. This is not just, we give out bursaries, and as I said, and even my first colleague mentioned, these are the places up country. If the school, the closest school has around 300 kids, and with the 6 teachers, and this you just realize that they want to work, and unless they come in and they have more teachers there, or like one eye for them, and we built new schools closer to the people, because we realized most of the pastoralism community, they didn't get their kid in school because all schools were very far, and the people, so most of the people, they have to be in a certain age to walk to school, but we try to do. And also we are doing, we will allocate HIV awareness campaign, and actually last year when we started, we managed to test 1,019 people, and over 600 people did counseling, and 2008 now in progress. We also allocate our money a lot in conservation, because we need wildlife, we need the livestock, and that's why you see they take a lot of amount, because it's taking a lot. That's the main, the control of wildlife, livestock, and maintaining bylaws. And we also allocate IGS stand for income generating activity. We try to build small activity like the traditional costumes and all this, and they try to market. We allocate infrastructure, like when you go to Ilmwesi, we try to channel water to get to the people. We try as much as we can to improve our roads and all this. One of my colleagues was telling me when we were driving to Ilmwesi, he never imagined on his life having the road going that way, or having the road in that place. And I will go through how it works. I didn't really put a charter and all this, but this is how it really works, and that's why we kind of get, and how it integrated. Community owning ideas and community leading the program. The whole idea is owned by community. When you look my top picture, that's an annual general meeting. At least half of those people have to sit. If today we agree we want to introduce something new in Ilmwesi, we need to, all the other committees and bodies just make that policy and they do all the, and finally it will be endorsed by AGM. So that's why they want that process. You will go there, read and go through and agree, and they just cut some part, improve that, and do that, remove that, and they own everything, because this is their land, and they have to decide what they do, and that really give us. And also develop management system. We really keep on monitoring, like we agree, this is where we went wrong, we need this body. Currently now we have like 5 committees running in Ilmwesi, but it was just one from the beginning. That's why we create an HIV program. We have a small task force doing that and all that. And the other thing is participatory decision making. There is no way today I'll just make a decision, let's do this and do it. No, it has to go through all the process. And all the time we work on developing the capacity of our committees, the people who run, because we say the communities run, so that's why we do a lot of exchange pieces. And also culture, the Maasai culture, their lifestyle and all this, the way they respect the meetings and all this accelerated. And also equal distribution of revenue have contributed, support from partners also. As I said, we work with there before, from working with the KWS and other partners have assisted us. And those are very much successful stories. We have now the lodge. We are able to introduce the black rhino, which has diminished over that years ago. We are also having a white rhino which never existed in that land. And we have one of the big awards we have appreciated through UNDP. It is 2002, where the UNDP recognized the work we are doing through using conservation to reduce the poverty of our people. And we have other main awards. And also we are able to create, as most of you know, that there is this short of job. But currently now we are the project are able to create 48 job position for our people. Most 99% coming from the local, and we have other 17 community which come up because of Ilingwesi, and we have the leadership declaration. And recently the new project is we are introducing holistic management, where we try to feed the cows somewhere, and we try, when they feed on all the grass, they will have the new grass. And these are the challenges. We are also going on the challenges. We have human-wildlife conflicts, which is really a big thing, because when the cow is eaten by a lion, it's just a total mess. They will try to kill the lion and mostly forget that. We have tourism marketing. We are not able to go all this venue and market ourselves and all this. And we have population growth rate. This population is coming always, and the pressure is something. And we have old and the generation and the young. Sometimes we disagree on several things, which young generation like few things and other don't like. And we have also big challenges on government, because the government don't know when they make policies, and we have no representation, and it just bring another mess. And we have other things like inadequate resources, inadequate infrastructure, threats, and international terrorism management. We have also, there's one case which was ruled May 2007. There was one tourist who got just an accident and crashed by an elephant, and he sued the whole community and the lodge. And actually the community lost the first round on May 2007. So in case they go the second round, because we are working on appealing it and they win it, we might sell all our livestock, our land, our lodge, and everything to pay 150 Kenya shilling, which is approximate, I am not sure exactly on US, but it must be something like, it's really like $1 million or something of that sort. And also we are now having a big challenge on political instability, which really we had to close our season, and I believe most of you know what really happened. And possibly we'll discuss because of my time. And these are the key lessons we are learning and we are sharing with the friends. All participation in decision making have been really one of the key things to help us succeed. And we have equal benefit of sharing. When you do this project, you ensure that the all communities benefiting, they are motivated and all this. And good governance and the partnership, when you run through good governance, partnership and flow of communication is very, very important. You know, when the community, this is their property. When they do you do anything wrong, and without proper information, they just like say forget the project and disappear. And we have also democracy, and how we elect our leaders. We just go to a general meeting, and we are today changing our board, and they will just vote normally and have our leaders in place. And then they know, and we divide that into different clusters and the community ownership. Thank you very much.
Okay, thank you very much, Kuntai. While Emmanuel's setting up here, let me just say quickly, as with the previous presentation, we'll have his presentation online. There's some information in case you want to take him up on his invitation to go out to the group ranch. And also there was a photo or two of some beads and some necklaces and bracelets and things like that. And I think you have, he's got some of those here if you guys want to take a look at them afterwards. So, Emmanuel, go ahead.
Good afternoon. Once again, my name is Emmanuel Mtiti. I work for the Jane Goodall Institute in Tanzania. I would like to thank you all for giving us your time, but most important, thank the Woodrow Wilson Center for organizing this event. What I'm presenting to you today is what Jane Goodall Institute has been doing in Western Tanzania, where we have a project known as the Greater Gombe Ecosystem Program. The whole story starts with Jane coming to Tanzania in 1960, Jane Goodall, and setting up a research center, and then starting a youth movement on environment. Finally, we started a program called Takare, Lake Tanganyika Catchment Reforestation and Education. And now we are having other programs like the Greater Gombe Ecosystem Program, as well as the Masito Gala ecosystem program. Excuse me. I mean, what I just want to show here is that when we started, like many other organizations, we didn't think about PHE. We just thought about the village land that was being degraded at a rapid rate. You know, we were in Gombe, Jen and now the colleagues were in Gombe, and they saw the difference in between the vegetation in Gombe National Park and the surrounding villages. What you see as dark green, that's the Gombe National Park, and the white towards the left, that's the Lake Tanganyika. So the park is just on the shore of Lake Tanganyika. And by that, then JGI thought like we can put up a program and tell people to plant trees. But do they really plant? Because what was the problem? This is the typical situation on environment within the villages surrounding the Gombe National Park. This village is just located south of the park, where we have about 100 chimpanzees. Now, the major problems, as you see, include deforestation, which potentiates soil erosion, and therefore we have the loss of habitat, and this leads to decrease in the ranging site for the wildlife, including chimpanzees. But why? Simply because our population has been growing very fast. We have tripled our population since independence in 1961, and we are having a lot of refugees in the area. Not to forget again that our birth rate is almost about 2.9%. And again, poverty and disease lead us to use our natural resources because they are the only readily available resources that we have. Now, the moment we started the program, it was apparently clear that when we did the assessments, especially the participatory rural appraisal, we found out that we are not targeting what the community needs because they had other priority needs. And we thought like environmental degradation was their problem, but then they said, no, we have so many other problems. And they ranked it, as you see, education, health, education, water, and access to capital. So environment ranked number 7, 8, 9. The highest was 7. So the conclusion was environmental degradation was not people's problem. So what do? It was JGI's problem by then. So the conclusion then came that we cannot work with these guys, with the communities, unless we include their priority problems. And that's why we changed our approach. I'm sorry, I'm trying to rush, to this model that we call a holistic model. This model calls for focusing on environmental, sustainable natural resource management, but addressing community needs, where we are doing the forestry and agriculture. We promote some cash crops. We do agroforestry and soil erosion control so that people sustain their living. But also we work on social economic development, which includes the microcredit. We copied a little bit from the Grameen approach, and we are supporting them with social infrastructures like classrooms, dispensaries. But again, on the other side, it came apparently clear that they need to have some family planning services. So family planning education, including getting the family planning methods. AIDS is, of course, a cross-cutting issue. And then the other one is the water and sanitation, which includes also sanitation education. From experience then, after working with people, all this grew organically. I mean, we were being told by people that you are going the wrong way, and then we come back, we revise. We just realized that now we have these synergies. So we are having these thematic areas: forestry, agriculture, water and sanitation, health and population, including HIV, and the whole issue of livelihood. And we have our roots and shoots, which is the youth environmental movement, included as an educational strategy for young people. What we have realized is it's cost effective and we share effort, but it also leads to increased effectiveness in implementation. Thereby, we hope to have improved conservation, and that's what we are seeing now, and the livelihood is improving. With that, we came to then to change our mission and vision that includes the ecosystem health and the livelihood of the people. So does our mission, which also encompasses that we have to work on the native habitat and wildlife, but without forgetting improving the standard of living of the local communities. Otherwise, they don't go together. People will not really understand. They need to cut trees for charcoal, and once they sell charcoal, they get school fees, or they buy their food, or they buy their medicines. Now, if you tell them that don't cut trees, then what next? It's like telling Americans, don't drive. So this is the change of focus. I mean, you can see how many years it costed us that we started with our initial idea that we are going to arrest the rapid land degradation. It took us something about 4 years or so to realize that we have to put people at the center of this of the implementation. I just wanted to share with you quickly our results framework, because some people might now start thinking, how do you put them together? Of course, we do. And we have 2 sub-goals, which one addresses reduction of forest deforestation. The other one is improving the livelihood of the people. Of course, then the other one, the green one, sorry. The green one leads to the health improvement, and the other blue one leads to good environment and livelihood improvement. We work through the local communities, and they have their own community resource own people who do the work. Our work is to facilitate and do the capacity building. So on the left, we have the conservation aspect, where we use the village nursery attendants. These are the people, and forest monitors. The village nursery attendants and forest monitors, they are volunteers from the same communities. We train them, and we equip them with working tools. The village nursery attendants, they get materials to develop nurseries. The forest monitors, we equip them with GPS and other gears to be able to monitor whatever is going into the environment. So they do mainly the activities like tree planting and tree planting campaigns, raising trees, monitoring the forest. And then on the right side, we have the health agents, who are the community-based distribution agents for family planning methods, who provide education and counseling on family planning, but they also provide pills to people. And they refer people for more complicated methods like injections, the Depo-Provera, and the surgical interventions like the BTLs. But at the bottom of the line, all these people are being coordinated by the village government. And what they do, they exchange clients that the conservationists refer their clients for family planning and water and environmental sanitation education, and the health people refer their clients to the conservation group for establishment of wood laws, environmental education, and things like that. And they're all connected by the village government. Now, how did we come to that? Just to emphasize that the reason why we went back to that was when we did a PRA, a participatory rural appraisal, and saw that people had different ideas than what we had. They had problems that needed to be addressed. And the second reason was, as we were now revising the other phases, the next phases of the program, we had to develop problem tree with them and try to see where can we cut the problem. And that's how we came with all those interventions. So this just emphasizes why and how we can keep our PHE integrated. And we have some lessons learned that PHE approach is cost effective and increases credibility. I mean, for JGI in that area, I don't know. There's nothing that we can introduce that people cannot accept, unless otherwise it's detrimental to their life. Because they know that we care about them. So when we come up with a new idea, they know that we still care for them. But on the other hand, we are seeing that by having the PHE approach, there is a high chance of sustainability. Now, the challenges, there are not many, though. Some of them, they are just usual challenges as you work. But a bigger one is the funding. When you are having different components and donors are not yet there to accept that you have to fund holistic approach. They would like you to be so specific. They say, I give you money for agriculture, only agriculture. If you do something else, you get into problems. We once had even problems with AID when we had AIDS money and we were doing home-based care. We found it important to do the voluntary counseling for people so that we give them better service. And they said, no, you are not for VCT. You have to do home-based care. You see? So you see how donors are so specialized. So then you find out that you have money for agriculture, you don't have money for forestry, and this has been a limitation to some extent. I think we need to do a bit of donor education. The other, on the community aspect is that PHE raises a lot of expectations. Because you are doing more than, let's say, 4 aspects, then they think like you can do everything. So it really takes energy to tell them, no, let's stop here. At least here is good enough. Just to wind up, I just want to say that this is what we believe, and I just want to remind you that Jane once said, only if people living around the wilderness become our friends that we can conserve. And I assure you, the baby chimp and the mother chimp up there, they are watching to see what we are discussing and what we are discussing and what we have to decide whether it really takes their interest as well, because we people seem to be greedy. Thank you so much.
Okay. All right. Thank you all very much for great presentations. I think we'll just turn it right over to you all. As I said, we're webcasting, so please wait for a microphone before asking your question. Who wants to get us started? Right back there, Sean.
Good afternoon, ladies and gentlemen. Hearing me? Good afternoon, ladies and gentlemen. My name is Rosemary. Good afternoon, ladies and gentlemen. My name is Rosemary Segero. I'm the president of Amani Club Ambassadors. Amani means peace. And Segero's International Group. I'm based here in Washington, D.C. I just want to thank the Wilson Building for this wonderful, wonderful event, and I thank the speakers for the wonderful speech they have given us today. For sure, what they have said is real, and I really support it as a Kenya whose business is in tourism and coffee and tea. And as they have said, you are all most welcome to Kenya, Uganda, and Tanzania for tourism. You are safe, and you are the people who will take the income generating there. So if you support them, and we should support them, visit, and thank you so much. That's the only thing I wanted to comment. And just a small question to my brother. He's in Laikipia. I come from, Kenya has 42 tribes, 42 people speaking different language. In fact, as he said, this conflict brought people together, and I come from Western Kenya, which is far from. He said, how do you get, or how can you involve our group of youth or community in Kakamega? Are you only looking at your Laikipia in one place, or you are looking in future to extend your what you are doing in other districts or provinces? Thank you so much, and God bless you all, and most welcome to Kenya, Uganda, and Tanzania.
Thanks a lot for your question. Actually, I can answer. One of the things we do is, as you see, we are receiving so many community visits. As ourselves, will just give more like lessons. You get there, you know, like now in this, people know that this is happening. Like we were talking with my colleague Metiti, he want to bring really a group of people there and to see what is happening. And from there, possibly you need to do another approach. But we have one project, HIV, malaria, family planning, and tuberculosis. We're really working on replicating that one because we believe it's the only kind of a HIV program we have started in a community approach. So currently now we are working on replicating and try to occupy of like Kipia North District and see how it works. And now we are in our first step, actually 6 months when we start working using the same approach in the neighboring community. But on wildlife, as people come there, learn, and we don't have really a resource center, I can say that. And possibly you might not find it because when we were doing PhD study, someone come there from Nairobi University and try to look for some record. You can start to get our record since in 1999, 2000. There before we were just running as a community thing. We really don't. But from now you can get some record. Our resource center is our elders there. People initiate a project. People like me and the other community members because we do awareness and we can get the resources and possibly build something like that in.
Okay, also in the back here, and then let's move up the line here.
Chachen from Bethesda, Maryland. It's fortunate that the three countries represent here have person with competence and compassion to manage those programs respectively. I would like to know that does the three countries have a school of public health, and if there's, are you expect to expand? If you don't have, will you plan to expand one? Because all the program you talk about are within the area of school of public health. I think if you would like to have, in my opinion, that the EU, like this USAID and UN, I think they would like to help you. Thank you.
Okay, thank you very much. Let's also take a couple questions, starting with Alice here, Sean, and then we'll answer the questions together, okay?
Sure. Hi, my question is for Gladys. And one of the things that you brought out, which is really good, is about the couples and people reaching out to the couples. And so I'm just wondering, how is that relationship transferring back to natural resource management? So the relationship between men and women in managing their resources.
And let's take one more there. Go ahead.
Okay, I'm Julius from Tanzania, a current student at Emory University, Atlanta, just visiting World Wildlife Fund. I have two questions. One for a lady from Uganda and
Kuntai.
Yeah. The first one is how do you look at
Sorry, Father.
Yeah, Gladys. Yeah. There is a big correlation between TB and HIV/AIDS, and I don't know how much are you focusing on HIV/AIDS with those patients who are suffering from TB. I think if you can comment on that. And the question is to Kuntai. How do you integrate, we know like Maasai people, they like cattle a lot. And what strategy are you using that to have, like maybe instead of having 1,000 cattle, then they can have maybe 100 to have a sustainable and reproductive cattle? So those are my two questions. Thanks.
Okay. Answer as you guys like.
start off with my questions. I think the general one is, yes, we do have schools of public health. We have Makerere University Institute of Public Health. Makerere University was one of the first universities in East Africa, and the Institute of Public Health is very strong. And then we also have Mbarara University. They have a community-based healthcare medical program. And actually, we try and work. They're the students who came out and did the needs assessment for the family planning. And as you say, it's very important that we should work with them. So I think if we can carry out some joint funding together with those, it would be very good. Then a question that you asked about, how does relationship with couples translate into natural resource management? I think the program is only 1 year old, so it's a bit hard to tell. But I think it's something that will be very good for us to track and monitor, especially to really enforce the PHE impact, social impact. But the fact that women and men are now talking to each other, for example, that lady who first came on the first radio show, she had 9 children and she was on the implant, which you can have for 5 years before you have children. And I said to her that, can you come on with your husband? She said yes. And she also came on with her couple peer educator. And I said, why don't you just have a tubal ligation? Because you've already had 9 children. She said, my husband won't allow it. I said, okay, but at least the implant is fine. So she came on and spoke. And we believe that, for example, when the CPEs go out to the communities with the flip chart, which I just shown, and they either go to group health talks or they actually go to people's homes as couple peer educators. By the time they've been through that flip chart, there's actually an instructor's guide, which we're now translating into the local language, which they will use with certain questions that generate a discussion. And some of them are focused around, how can we better manage our resources so that we are not poor and we can get the most out of them. So hopefully, since the couples will be engaged in talking about family planning, they'll also be engaged in talking about that. And then with HIV/AIDS, when we started the TB program, I guess because our program was the focus of our program generated from wildlife health, gorilla health issues, we wanted to focus on diseases that are likely to spread between people and gorillas, like TB or scabies. But of course, because of the greater than 50% TB and HIV co-infection, there was a lot of pressure for us. Everyone was like, you should also get involved in HIV. And yes, we have included it on our programs, but we would rather partner with the existing health centers for the actual treatment of the HIV patients. And the Bwindi Community Health Center is actually now become one of the Joint Clinical Research Center sites, and they get funding from Joint Clinical Research Center, which is the biggest research institution for HIV/AIDS in Uganda. And they do have VCT, they do have HIV drugs now are available. Antiretrovirals are available for the community. And so they are very happy to team up with us. And what we try and do is, the moment somebody's coughing a lot or they're a TB suspect, we strongly encourage them to go for HIV testing as well. And actually, another reason why BCHC wants patients and not sputum samples is that once the patient arrives, they're able to counsel them to also get an HIV test, and because they have a more of a holistic program. Unfortunately, the government health center doesn't yet have the VCT and the antiretrovirals, but hopefully in the future they will get them as well.
Thank you. Going to first general question. One, I know there is these big institutions, like in Kenya, I think there is 2 universities which are really offering medical things, which is Moi University and Nairobi University, but also we have small institutions also which are doing stuff. But we are having one of the big challenges, and this is now a big challenge. When you go to most of these countries, possibly even to US, when you get to US, in Washington, there is very big doctors, big hospital. And even in Kenya, when you go to Nairobi, everyone will be sent to Nairobi. Everyone will send to this big city. So remember, we are there up country. We don't have this institution. So actually, when I talk of that program, what we try to say is, over 2 weeks ago, we already trained 50 people. We just we call them peer educator on just these basic skills, and we try to have this small document. We don't do a lot of research. Possibly that is one of the components we are now trying to build with the partners and all this, and have resource center and all this. But we train peer educators, and we have people like the current who are supporting us on training Avia 2 wishes and Family Health International, and we partner with the government, and we train these people with the basic skills. And now when we go back on the field, we try to build the capacity. And already we have 50 people who went through that training. And we have around now 200 people went through training on HIV. As I told you earlier, that HIV program is now 1 year, 6 months old in Ilmwesi, and the other ones are only 6 months. So when we train, we send these people and they try to give message. And from now there, we try to follow up, and the community will develop this interest. And our main other thing is we realize that all these people, medical doctors and all kind of health people, all of them are based in these big towns or where there is good infrastructure with the big cars and even big what, and all rural people there, they are suffering. So our main thing is we try to build institution, we try to work with the mobile clinic, and have these people, like recently we have a tour with the district Ministry of Health officer. We bring them down there and you tell them there is a pregnant woman who need to walk for 30 kilometers to go to clinic. How does she really go for that clinic? We have HIV, and how can he make sure that she get tested? And that's one of our other major role. How can we get these people from this big town to see that there is other people who are in up countries and they don't have these services? And that's really what we are working, but we are not really working with the big institution or having our people going to this doctor. But actually we manage now as a community through FHI Fund to manage 6 counselors from the local community who are testing HIV, AIDS, and do mobile thing. And on the interesting question on really reducing the number of livestock, it's one of the interesting and the hard one to answer. Because in the life of the Maasai, they believe on cows. I don't think there is a Maasai, including me, who can live without cows. And for the history, they ever keep on working hard to increase the number of the cows. So that's one challenge. But we really not addressing, and but some of these people, they realize somehow, because when you interview them and talk to them, they say it's a big problem because ears are changing, and they don't train like you used the way, and also population is growing. Some pressure, things are reducing the number of their livestock. But currently now, we have just started working on holistic management, but really it is taking time to find the right approach to reduce the number of livestock, because when you come to that, it might even destroy all other important programs, because they always work on increasing their cows. But I don't know whether personally I am working on increasing the number of my cows. But possibly in one way or the other. But actually, we don't really have a tight program. But currently now what we are trying to do, for those who have been in, who have been in Laikipia, we have these big ranchers, people who own land, who come there to do the European movie to Africa or colonial era. So we are building program where the big ranchers, they own big land, like even the closer ranchers like Lewa, Borana own 5 times big ranch than Ilmwesi. And we are a community of 600 people. So we now starting to build some program in the dry season. If we have high droughts, the people can have their livestock in their ranches, but obviously under some condition. And you will work under private condition. If they disagree, you can just, they can send you out any time. But we are having that is a very big challenge, and we can appreciate if you have any skills on approaching that. Thank you.
Well, contributing to the first question, I also say yes, Tanzania has a public health school. But picking up from the family planning story with conservation, let me say that it's starting to the communities to go every time they see a health specialist or an extensionist or someone going with a single topic. So you call them today for, let's say, conservation, call them tomorrow for agriculture, the next day for cholera, the next day for malaria. It's really tiring, and they have a fatigue of meetings. So if you sit on a family planning session and then you also discuss about conservation, that makes it more acceptable, and they feel like it's a better use of their time, and it goes all together. That's it.
Okay, any other questions? Rachel back there, and then Heather, and up here. Go ahead, Charlie.
I think this is a real fabulous example of how to work in this very difficult area, trying to link population health, environment, and livelihoods, and get the community-based approach. I have two comments, knowing each of these, having worked or observed in each of these three areas. I have two comments. One has to do with community-based programs. If you're trying to do holistic management, of course you have your communities as civil society, NGO, but you've all mentioned the difficulty of getting government involved. But I'm wondering if the government ministry, if it's the health ministry that's the most appropriate. I would think in some of your countries or some of your districts it might be a local government or some type of integrated rural development. So I would think that maybe they would be more understanding of your holistic management than trying to get the health ministry involved. And my other comment is, while it seems that you are moving slowly and having some initial successes, there's nothing better for success than having the people realize that their lives are improving. And I'm wondering how, in your monitoring, you've mentioned difficulties in monitoring and in collecting data, right? It is very difficult. But when the community is involved and they collect their own data, they do participatory assessments, they can begin to realize what improvements there are. So I'm just wondering, you could have the community doing its own monitoring, but also you can have local university students getting involved maybe in more of the statistical aspects. Local surveillance systems that we've been working with in Tanzania, I mean, some of the indicators have to do, again, with cows and cattle and food security and meals. These are some simple indicators. But how would you see using the participatory approach to monitor your advances and your successes?
Okay, Rachel, and up here with Heather.
Hi, I'm Heather Diagnos, and I work at USAID's Office of Population and Reproductive Health. First of all, thank you all very much for excellent presentations and for bringing your stories here to Washington, D.C. It's a long way to travel, so thank you. I wanted to ask Mtiti a question, but I welcome answers from everyone else. And the question is regarding your comment about donor education, which I agree with before I ask my question. But as you know, I manage the Population Health Environment portfolio, and yet I am bound by these same problems that you talk about, which is when we give money, we're interested mostly in the family planning and reproductive health outcomes rather than the environment outcomes and the health outcomes. And my question is, how can we educate donors, me being in this situation, what can we ask donors who are looking for one very specific outcome? And what could broaden the interest of donors to support these kind of programs, or even a donor like USAID that is very stovepiped? Do you have any recommendations for me to take forward, perhaps, or for other donors, too? Thanks.
If you could just pass the mic down one more.
Good afternoon. My name is Karen Becker. I'm an Animal and Public Health Advisor in the Africa Bureau here at USAID. And this was an excellent presentation. I'm very appreciative of it. Thank you very much. Gladys, at the beginning you mentioned one of the limitations was incentives for either collecting samples or testing of samples. And because I do a lot of work with trying to enhance surveillance systems and getting early detection of problems, what do you think some of the solutions might be, or why is there a problem? Is it because they're not getting paid, or because they're not getting trained, or they're just too busy doing other things in their day. I'm just interested in maybe how we can seek solutions to that very common problem. Thank you.
Okay, go ahead, whoever wants to go first. Maybe Nditi, you want to start?
Yes, I mean, thank you for the good questions. I mean, some of them are challenging. Let me start with question number 1 about government involvement. Well, I don't know the case with my colleagues, but from my perspective, we don't have any problem with the government, because what we are doing was supposed to be done by the government, and we as NGO, we are just complementing the efforts of the government where they could not accomplish their mandate. So I can say briefly that it all depends on how you introduce your program. If you just sit in Washington, you prepare your package, and you pack your briefcase, you go down to Kigoma, and you say, listen, you guys, I've come here to solve your problem. That is a huge mistake, you know. But if we are working together with the government, I don't see the problem, because for us, for example, JJ has have been there since 1960, and we're involving the government from step to step. Whenever we want to put up a program, we first discuss it with the government, and they know everything which is going. Why should they be reluctant at the end of the day? So for us, it's not a problem at all. It's an issue of regular involvement of the government departments and the responsible ministries or whatever. We have a good relationship with the local government. We have a good relationship even with the parliament, and we have a good relationship with the ministries and even the president. You know, so we have an opportunity to sit down with the president and tell him what we are doing. And at the local level, it's a matter of regular meetings, giving feedback. It's not that whatever you do a survey today, and then they sit quiet, and the next day, when you go back after 1 year, say you ask the same questions. Why are you asking us again? But if you brought back the feedback, then they know what is happening. So in my case, it's not an issue at all. Now, moving slowly, yes, I say yes. We have to move slowly, because communities are not static. They're not academic institutions. You know, they are people. They have some other priorities. I mean, they have people from fast learners to laggards, you know. So you move with them. If you want to move alone, then you just found that there is a huge gap in between you and them. So you move with them. Our case has been that, for example, as regards to what you mentioned about data collection, we use them to collect initial data. But the problem is, you train them, they go back, and then you follow. You have to follow to make a follow-up visit. We call them monitoring visits. You find they still have problems in, let's say, collecting certain data. That's a topic for the next refresher training. So you keep on training them. And this is what sometimes, I'm sorry to say this, donors don't want. You are doing too many refresher training. We think like it's a trick of getting money. But of course, we have to do that, because we have to go with the situation. So it's about that. But also, just to mention that data collection is by itself a project. So having someone within the project, like monitoring and evaluation specialist or officer or whatever you call him, is also important. And this person has to be responsible to make sure that all the data matters are being taken care of. Now, the difficult question is, how do I educate donors? Well, maybe we can do a campaign. It's fine. But what I just want to put clear here is that sometimes we tend to cheat ourselves. I say I'm doing health, she's doing agriculture, and she's doing, let's say, conservation. But the bottom line, we go to the same person. I wish like we could have some sort of machete, and we divide people, say, this side of you is agriculture, the other side is forestry, you know. We go to the same person with different messages and taking all their time. These people, they want to be in their farms, you know. So it's better that we consolidate and make better use of their time, and we give them enough time for their livelihood activities. So maybe this is the message that we can tell donors. But as well, how many? I don't know how many. I cannot figure out a percentage of operational costs that donors incur by running parallel programs. Because each program, let's say, you have 4 programs, and then each program has a director. So you have director of Mtiti number 1, Mtiti number 2, Mtiti number 3, Mtiti number 4, all those salaries, So this is the message. I'm not sure whether I don't have a direct answer to that, but this is my personal reaction to it and my personal feeling. Thank you.
Okay, I think I'll focus on the question on how do you give incentives for sample collection. Actually, I don't think we've had so much a problem with that. The biggest problem has been how accurate is the data. Because we're working with people who have little education. A lot of them only stopped in primary 7, and they don't even speak English very well. So in fact, they mainly speak the local language. So when we have the meetings with them, they always have to be translated. Almost the whole meeting is in Ruchiga, which is a local language. But I think probably one way that we can get them interested in continuing to collect this data, because I remember when it was like, okay, the first time they just collected straight family planning data. Then we were like, but you're visiting homes, we want you to visit homes that see gorillas. Now you have to include that in your data collection. Now we want you to talk to them about TB, HIV, and scabies. Now we want you, and how many homes did you talk to? And then each time we were adding something new, and it involved more training, and they were getting tired. But then I think there's a lot of education and sensitizing them why it's very important to include everything that we're trying to include, and getting their feedback. But one thing that they're very interested in is, one of the meetings we had, the quarterly meetings when we had everybody, the crews and the CPEs, we showed a graph of the level of effort that they've been doing over the months, and they were very excited. And we feel that the more that they become computer literate and can understand, they enter the data into the computer, and we show them different graphs, it makes them motivated. So they're getting a direct feedback to what they're doing. And then with the TB, it's really mainly our nurse aide who goes out to collect the samples. And he's great, he's very motivated. But the reason why the community members don't want to go all the way to the health centers is they're just so far away. But they do want to be tested. And actually, when we also had a pilot radio show for TB after we did the family planning. And Gashum told us that there was much more reaction after that compared to the drama shows. Because people came on who had recovered from TB. They came on with their CB.s volunteer. They talked about how they're feeling so much better having been on this program. And then he had so many people contacting him saying coming out to say they want to be tested, including members of the Hugo team, the Human Gorilla Conflict team. So I think giving people feedback, as Emmanuel Mutiti said, can help a lot with the data collection.
Thank you. On just involving the government, I think all of us, we involve the government, but in different levels. One of the level, I think, is we have scouts. Actually, the most hard part on the government is having them supporting this program and having them doing what they're supposed to do. But one of the role is we really work on we are working for them now, but we really want them to work for their people. But actually, we are working with them, and they are doing really well in some part, like in security part of Ilmwesi and conservation they are doing, because they do the evaluation and realizing that, okay, Ilmwesi is capable of having the rhino in their land, and they can allow the rhino to be there. Ilmwesi is able to handle the government weapons and all this, and they give that. I think we are working, and in some part it's really hard, like infrastructures and having water and all this. That's why in some part really they are not doing good. That's why we are working our own, and also by letting them knowing we exist, it might help us to get known and them to help us. But just going to monitoring, it's a bit different from us, because from what the guy said, this is our community project. We are not really very much big interested with seeing this data, because one of the things The communities themselves say every year we try to allocate a certain amount of fund for education. If it's not there, they will say, what happened? That usually that tell you that they usually know that usually we distribute our fund at the end of April. What happened? You didn't distribute. Why? What happened? Because, and this is the community where the message can go very quickly. So these are kind of monitoring. But actually recently we did a survey on how can we support women's on small IGAs. We are working on bringing women's in table for a long time. And I think for most of African culture, we really didn't, or many other people in the world, they didn't really have women's on table and all this. And even today when we elect women, or we give them like just a appointment to sit on our boards, they just disappear from nowhere. Just they go and disappear. She don't attend this meeting. I think this is because to cultural values and belief and all this. So we recently did a survey, and on that survey we tried to do an HIV question. But we realized people are getting like 70, in that survey we realized 70% of our members have information on HIV/AIDS. This was a great thing. And that's very much how, but currently now things are moving. We might go to other part on documentation and all that, but possibly why we are not working very much with the developing partners, as my colleague said, donors and all this, because possibly most of these people, they are interested on numbers, data, and all this. And because we don't have this, it really limits us working from so many other people. And that's another one challenge. Possibly we might need to go to that, I'm not sure, but we'll find a way. I really think on educating, I need to support my colleague who say on educating donors. I think this is one of the big challenges the communities are undergoing. One, if you go to most of these projects, I don't really think most of them are working to satisfy their societies or their community. Because I think most of the developing partners, they tell you that before they give you your fund, they must look at your structures, how they work. They must try to see if your records, how they are. So also they tell you that if you go to this most institution, they are really busy in the offices. Their staff are very busy in their offices trying to standardize their record for them to qualify to get those funds. And when you look at my approach, I'm busy working on improving the livelihood of my community. And it became recently a very, very, very big challenge when we were applying FHI fund, because these people really want us to fit on them, but us, we want them to fit on us, because if we fit on them, we will satisfy them on record and this. But actually, when you go back there and do a survey, the community is not benefiting, but other people are busy writing this record and this. So I think it's high time the donors also needed to look at our approaches, and at some point we disagree, and they took some of our fund in our proposal, and it just happened to be another mess. But actually on an education of donors, I think the preliminary or something like this, so many of them, we are donors somehow. Even me, I'm a donor somehow. So this is another way of educating them and telling them this is actually need to happen. Thank you.
Thank you. Okay, I know there are a lot more questions. I have some too, but unfortunately we're out of time. I just want to thank so much our speakers for traveling so far, for giving such great presentations. And thank all of you. There's another program starting here in just about 15 minutes or so. So please continue conversations, but let's do it out in the hallway.